You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome to Let's Talk Business. My name is Kelly Bolton, and I thank you for tuning in as we have the distinct pleasure of hosting our community's foremost leaders and entrepreneurs. Today, we're thrilled to have with us Dr. Jeff Kalmowicz. He's a practicing dentist in Memphis and an assistant professor of dentistry at the University of Tennessee Health Science Center, UT College of Dentistry. It was established in 1878 and is the third oldest public college of dentistry in the United States. Dr. Kalmowicz has been in practice for 28 years and in 2015 published a study on dental sealants and bonding techniques. Being on the forefront of putting the latest research into practice, Dr. Kalmowicz can provide valuable insights into all the significant developments in the field of dentistry for the past 30 years or more. So without further ado, let's talk business and dentistry. So thank you so much for joining us, Dr. Kalmowicz. I appreciate it.
Thank you for having me, Kelly.
Well, good.
Pleasure.
Well, normally I start out by asking the guest, tell me a little bit about what is a. So I think most people know what a dentist is, but maybe you could tell us a little bit about dentistry, and it's not just the teeth. So tell us a little bit about what a dentist does, because a lot of people, I think, try to save money a lot of the times and think it's my teeth, they look straight. I didn't break anything off, so I don't need to go to the dentist. But you're doing a lot more in the mouth than just looking at the teeth.
That's true. Yeah, we're looking for pathology, oral cancer, various diseases. You know, oftentimes patients, if they do come to us, they may not go to a physician regularly. So we not only check their mouth, we're going to check their neck, and we're going to look at their eyes and ears, and we're going to give them an exam from the neck up. And if we see something suspicious, we'll refer them to the appropriate specialist. So yeah, we do more than just clean teeth or repair teeth.
Well, and that's important. I can't tell you how many times in my line of business, because I do money management, you know, I hear people when times get tough say, well, I don't have good dental insurance. Next year I'll get better dental insurance, so I think I'll skip the dentist this year. Or I'm not going to go to the doctor this year because I haven't met my deductible. Next year I'll do it all at once. And for some reason, in my experience, I see the one area of medicine that they want to cut is the dentistry, because they need to see, but they think the mouth is not as important. And I'm glad you shared that about even viewing things like, you know, oral cancer and that sort of thing. Well, you've been around a long time and you've been practicing for a long time. I know it's a little different getting in dental school today than it was before, but how difficult is it now to get into dental school?
Good question. So at UT, and I'll just talk about UT since I know that a little bit better than some of the other schools, but so the class size is 100 students per year.
Oh, wow.
And it's
so
4
it's
years.
not big.
It's not big. Well, it's bigger than, take the University of Mississippi, for instance. It's only maybe 40 or 50 students.
Oh, really?
So it's double Mississippi, but it's 100 students. And it's pretty competitive nowadays. There are usually about between 1,000 and 1,500 applicants for the 100 spots.
Oh,
So
that's competitive.
If you do the math, it's a 10 to 15 to 1 ratio, but it's still possible to get in.
But you definitely need to kind of start preparing before the day you go to take the test.
Absolutely. So there are two main criteria, although there are others also. There's the GPA, which of course the higher the better, and there's the DAT, the dental admission test. So both of those are weighed pretty heavily, plus other activities. They look at your activities, and maybe you've been in the workforce for a few years, or maybe you were a dental hygienist or a dental assistant, so you have some, or a laboratory technician, so you have some previous dental training. That's usually weighed into the decision.
Well, are there any courses that someone should take in college in preparation for getting in dental school?
So I'm a science major, so I took a lot of science courses. So certainly science is preferable. The biology and zoology and chemistry and physics certainly help you when you get into dental school. But I've taught students who are music majors or math majors. Now certainly they do have to take the necessary science courses to get in. So, but and business majors too.
Really? Very
yeah,
interesting.
sure.
I guess at that point, when you graduate then from college, you take the DHAT? You said? DAD. Okay, so you take the DAD, then you interview, and if you're fortunate enough to get selected, say for a UT, College of Dentistry, then you're one of 15 or one of 10, and then you do what? How long are you in school? Do you do residencies? How do you learn the practice?
Good question. So the program is 4 years, undergraduate program. So when you graduate in 4 years, you have a DDS degree. But maybe a third to 40% of the class will do some residencies. So you can do anywhere from a 1 year to a 4 to 6 year residency.
Oh, really?
So the difference between dentistry and medicine is after you graduate from dental school, you literally could go to work. Whereas physicians have to do a mandatory minimum of 3 years after medical school. So we have a little head start on physicians. If we decide to do a residency or the student feels like they want a little bit more training, they can do a general practice residency, which is usually a year, or they can do a pediatric dental residency or endodontic residency, which is root canals, 2 years. Periodontics, study of the bones and gums, is 3 years. Prosthodontics, which is a branch of dentistry which deals with complicated restorative cases, it's, like I said, 3 years. Oral surgery is 4, and periodontics is also 3 years.
So any place from 4 years of 4 years of college, 4 years of dentist school, and you're a dentist, to a couple of years of a residency, up to 4 years for oral surgery.
4 years for oral surgery, and if you want a MD degree oral surgery, you can do the DDS MD degree, which is 6 years. Now, UT doesn't offer that. I think Vanderbilt is the closest residency program, but yeah, so then you're a DDS MD.
Okay, okay. And what is it when you can do more reconstruction of the whole jaw? That would be the 4 year, is it maxillofacial?
Maxillofacial.
Okay.
Yeah.
Is that more of plastics and dentistry?
It is. That's why some oral surgeons decide to do the extra 2 years, so it's a 6 years after dental school.
So that gets the MD.
Absolutely.
Plus,
They deal with more plastics.
Okay.
Yeah.
So there's a lot of education you can get when you get out of school. And if somebody, so you go and you're 4 years of school, 4 years of dentistry school, and you choose to do a residency or not, well, how do you start? Because you've got to get some patients. So what typically happens for someone that's graduated? What's their next step?
Well, I was fortunate enough to purchase a practice. So that's due to the cost of dental school. It's a little bit less frequent nowadays. So most of the students are, if they're not doing specialties, most of them will work for corporate dentistry, or they'll associate. And they'll be associates for a few years, and they basically build up their speed and make a little money and get a little confidence, and then they either will become partners in that practice, or they'll branch out on their own and open their practices then.
Oh, that makes sense. And thank you for answering that. We're going to take a short break now, but when we return, we will continue our discussion with Dr. Jeff Kalmowicz, so stay with us.
We see the potential in every single student.
That sounds like a confession to me.
I love watching these kids as they start as freshmen in high school and watching them mature and grow.
At last, my right arm is complete again!
The theater program at GHS, it's something special.
Is very intensive, it's very interactive.
When a student starts here their freshman year, they start with Introduction to Theater. And after that year, they have a choice to either go into acting or technical theater. And then after that, they join our production workshop class. It's the class that is completely run by students.
The students do mostly everything. We build the sets, we do lighting, we make the costumes, we do the shows.
It's very fun. I mean, everybody's very supportive of each other.
Now we're all in this together.
It's taught me so much about how to act and how to have a stage presence.
Not only are we teaching the students the skills that they need to be a great performer or a great stage manager or a wonderful lighting designer, we're teaching them skills that they're going to be able to apply to whatever they do in their life.
You guys are fabulous!
This department not only makes wonderful theater, but more importantly, This department makes wonderful people.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Let's Talk Business. If you're just tuning in, I'm Kelly Bolton, and today we've been talking with Dr. Jeff Kalmowicz, a Memphis dentist and assistant professor of dentistry at UT Health Science Center, as he shares his insight and advice for those aspiring to join the medical field. So we were talking before we took a break about corporate dentistry, and I'm going to have to stop and ask you, what is the difference in corporate dentistry and practicing with someone like you when you get out of school?
Good question. Okay, so about 10 years ago or more, hospitals started purchasing physicians' practices.
Right.
So a private practitioner like myself, overhead is high. You have to pay everything on your own. Equipment is very, very expensive. And as technology, unfortunately, improves, the cost goes up with it. Mm-hmm. So the cost sometimes for some of the equipment is just cost prohibitive for an individual practitioner, physicians included. So hospitals came up with this idea, well, we'll buy these practices and the physicians can work for us, and then we can give them everything they need. We'll have all the technology, or they'll group some doctors together, which makes a lot of sense. So then a little light bulb goes off and some dentists say, you know, if the physicians are doing this, then maybe we can do this. So a group of dentists, everything usually starts in California or New York,
right.
In this case I think probably California, said, you know, let's see if we can do the same concept in dentistry. So they started opening corporate dental offices in California, then they moved to East. Memphis is usually the South is a little slower, getting a lot of new things. And a couple years ago, we started getting some corporate dentistry. So it's strength in numbers. You can afford to buy dental equipment. Dental equipment is very, very expensive now. There's a lot of really, really nice technology out there, but it is very, very expensive. So it does help being in a corporate situation when you can, these manufacturing companies will give the corporations a little bit better discounts than we can get. Mm-hmm. So that's one of the pluses, I guess.
So it's kind of economies of scale. Does it mean that you practice, when you're in corporate dentistry, do you practice under the same office where there's one machine and you share, or multiple machines?
So yes, both. You could have one machine or multiple machines, depending on the size of the office.
So it makes sense because you do get some economies of scale. You buy things in bulk, or you might need a wonderful piece of equipment, but you don't use it every day.
For instance, there's some technology called a cone beam, which is sort of like an MRI. Mm-hmm. So most people have heard of MRI or CAT scans. So this is our little MRI. These things can cost $200,000 or $300,000.
Wow!
So that's a really, really big investment. So certainly, corporate can afford a little bit more than than a smaller practice.
Yeah, that's very interesting. I had no idea that equipment had gotten so expensive. So how many dental schools are there in the South? If somebody's looking for dental schools, how many are there here?
So in Tennessee, there are two. There's one in Memphis and there's one in Nashville. Mm-hmm. Alabama has one in Birmingham. Mississippi has one in Jackson, a small one I mentioned earlier. There's not one in Arkansas. So the University of Tennessee has an agreement with Arkansas that we take 20 to 25 of their students every year.
So are we educating enough dentists? It doesn't seem like there's enough. I'm just thinking in my head here as you're naming this, with the dentists that will retire and all of the population of people that have teeth that need oral care and that sort of thing. Are we educating enough dentists today?
I think we are, because you have a good number that are retiring or just leaving early or doing other professions. So I think we are. It seems like everybody that graduated from UT eventually gets a job. So I think we're good. I don't think.
But we're not going to be short.
I don't think so. I think it's good. They've opened about 10 dental schools in the last 10 years. Seems like one is opening a year. So I think it's meeting the demands of the population.
Well, that's good. That's good. Well, tell me, what do you enjoy most about being a dentist?
Wow, so many different things. Changing people's lives.
Yeah.
You know, teeth are one of the first things that we look at when we look at someone.
Right.
And if someone is ashamed of their smile or has to put their hand over their mouth, if we can help them to give them a little self-confidence, it's really makes us feel good.
That's great. And have you always practiced in Memphis?
I have.
Okay.
Yeah.
So you said you bought a practice here in Memphis.
Yes.
That's interesting. Let's talk a little bit, kind of shift gears and about the money, not what you're making, but what people are paying with insurance and that sort of thing. What advice would you give somebody when they're trying to decide, which dentist should I choose? Which healthcare plan should I choose? Because I can go to this dentist for this cost or this dentist for this cost. There's just a lot. I don't even know where to start with the question.
That's true. We could talk for a long time on that topic, but I wouldn't. So that's one area I wouldn't look for the best price. You want to probably get the best policy that you can, because like a hamburger is not a hamburger, a filling is not a filling, or a crown is not a crown.
Yes.
So there are just different qualities, and I always tell people, it's your body. Why not put the best that you can in it? Just like you would want to go to the best doctor and have the best services with a physician. Why not teeth also?
Because I understand even some medical, I don't know what you call it if you put an implant or a crown or things in your mouth.
Sure.
A lot of people might make the implant, or some doctors do, some are done by labs, crowns and that sort of thing. But I'm understanding that now we're getting some shipped from overseas that may or may not have the same quality, which is important.
That's exactly right. If it's not covered by the American Dental Association or under their auspices, it's not regulated. So if it sounds too good to be true, it usually is.
Right.
So,
and that makes sense. I think, if you were going to have brain surgery, you wouldn't shop for the least expensive brain surgeon. And if dentist A can provide a procedure and it's going to cost $200 and dentist B can do it for $25, you've got to ask yourself, what am I missing here?
So there's something called travel medicine and then travel dentistry, where people will literally go to Mexico, or they'll go to like Romania, they'll go to certain Eastern European countries to have procedures done. And then they're coming back and they're having a lot of problems, be it dentistry or being medicine. They're having a lot of problems. And then unfortunately, sometimes it's harder to correct the mistake than to have done it in the first time.
I've heard of someone actually doing something similar to have almost a full set of implants, and it was a disaster, to say the least. But tell me a little bit more about selecting a dentist. What should someone do when they're trying to select the best dentist? Obviously, we've talked about cost. Cost is not the most important thing, but what else? What other factors should they be looking at?
So that's a very good question. So you're going to we get our best patients from our best patients. So referrals for us are a really good thing. So you talk to your neighbors, you talk to your coworkers, you ask them who they go to, if they're happy with them.
Well, that's great.
Yeah.
That makes a lot of sense.
Sure.
Thank you.
Sure.
It's time for our next break, but when we return, we will finish our informative discussion with Dr. Jeff Kalmowicz, so please stay tuned.
It's very fun to be in band, trust me. It's so much fun.
When I was an 8th grader and I saw them march, and I was like, wow, I need to be a part of this.
Our main performing group is the varsity band. That encompasses our marching band and our varsity concert band. We also have the jazz ensemble.
It's unique, so we're really lucky to have that.
I'm very methodical about teaching. I try to stay up to date because I want my students to have the best information that I can pass along to them.
He's excellent. He commands a sort of drive that we didn't exactly have.
I lead the class, but I also believe in the students self-assessing their work.
The leadership is led by the students. We lead most of the practices. It's basically just student-led.
And I think that's important for them to take that kind of ownership.
If you want to be a musician, you gain extremely important music skills, music techniques.
1, 2, 3.
There's so many opportunities for fellowship, and band is a family, and you develop that small community where you support each other, not only musically, but in many ways.
Really, without the band, the football games would be lame. Without the band, you wouldn't really have the pep rallies. The band is like a good foundation for the school spirit. If you want to join band, just do it.
I think band was the best part of my high school career.
For more information about the Kappa program, visit GHS-Kappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Thank you for joining us on Let's Talk Business. Today we're honored to have with us Dr. Jeff Kalmowicz, a practicing dentist in Memphis and an assistant professor of dentistry at the University of Tennessee Health Science Center, as he shares with us his expertise and guidance. I wanted to continue our discussion about some of the technology. You know, I have a friend who is a physician in radiology, and she was talking about all these new innovative things in radiology and which hospital had the latest and greatest. And you were talking about some of these things in dentistry. What are some of the new innovations in dentistry that we could take advantage of as patients?
So they have milling machines where you can actually get crowns in a day. So
really?
you come in the morning, and the dentist performs the procedure and scans the tooth, and then a few hours later the tooth is milled in office and then placed in the mouth. So although not instantaneous, it could still be done in one day. So the patient may only have to take off either a morning or maybe just a day, as opposed to maybe taking off 2 appointments.
Wow.
So that's relatively new innovation. Also, we have lasers, which are really interesting, and you can do some filling sometimes with no anesthesia.
Really?
Utilizing the laser.
Well, tell me about that one. How does that work?
So the laser utilizes water, so there's water with the laser also, and it doesn't affect the nerves in the tooth. So now it's not for everything. So, and it's not for, so you can't remove silver fillings or gold crowns with it.
But it's something that wasn't available years ago.
Absolutely. So if the tooth has never had a restoration and it's small enough, and particularly for pediatric,
Very interesting.
It's really a nice.
Because I got to tell you that the most pain I've ever felt in my whole life is a shot in the mouth. I don't know what it is about it, but when you said no anesthesia, I'm like, sign me up for that.
Absolutely.
There is something about the way that the pain. Now, I will say one thing that I have noticed in dentistry that seems to be better, and I'm very blessed. I have had very healthy teeth and no cavities or anything, which has been great. So my shots in my mouth have been very minimal. But I think the last time I had to have something, it was so much different than the first time because of some topical something that they even were able to put on there.
Absolutely. Now, not all dentists do, but I do, and we certainly teach it at the dental school. So certainly the topical sort of takes the edge off.
It definitely does.
So yeah, an application of topical for a minute or two. Usually you can do a painless injection, which is, like you mentioned, is one of the,
it was totally different.
Yeah.
I remember as a child, and obviously they say, you know, over time you don't remember the pain of certain things. As a child, I had a shot in the mouth, and it was the most pain I've ever felt in my entire life. But it was years ago, and that sort of thing. Well, so lasers, crowns, anything else? I mean, it's really kind of fascinating.
Like we mentioned earlier, we have the cone beam, which is like an MRI. So we can look at we can look at the head in 3D. So we can see nerves, and we can see a lot of vessels, and we can see a lot of things that we couldn't normally see. So.
That's fascinating. Yeah. That's fascinating. Well, you know, I will tell you, I'm going to ask you this question about social media, but I'm a person that probably hasn't watched a commercial in years, because now with the, what is it, where you know, TiVo through, or you fast forward record shows, and you just, I don't remember the last commercial other than somebody said you need to look at this commercial. Social media, I do receive if I'm looking at something, because for some reason that smartphone or that computer remembers any place I've looked at, and stuff goes in my feed. But I'm hearing a lot more about dentistry through social media, you know, and promoting business, doctors, lawyers, that sort of thing. So what's happening in the field of dentistry with social media?
So certainly a lot of the younger doctors are really big into, that's what they grew up with. So they're
Right.
they're really big into social media.
Right.
So I guess it depends on the age of the clinician.
Right.
So being a senior practitioner.
More experienced.
More
Yeah.
experienced, thank you, yes. I may not be as savvy as my son, for instance. He knows everything, and I don't. You know, I'm you know. So, but I would be careful with social media too. Not everything is posted is factual. So you have to be really skeptical. And like you mentioned earlier with referrals. So if you're looking for social media for referrals or people's websites or other sites, just be careful, do your due diligence, ask your friends and your neighbors and your coworkers who they use, and then you should hopefully make a good decision.
I think that's really good advice, because I have seen something that looks the brightest and the shiniest is not necessarily the best. Just because someone can, it's not just dentistry, it's in any field, can promote themselves and make themselves look good, doesn't mean there's substance behind it. And I think the referrals is a really, really good thing. Yes. But I am noticing anytime, even if, let's just say I Googled, there was something medical, I can't even remember what it was, I had a question on something I Googled the other day. But I promise you, if I Googled what's the best toothpaste to use, somehow or another, when I go to turn on my computer or my phone, it's popping up, and it's feeding through. And I'm sure your son and the younger generations would know how that's done. And then something popped up that looked like too good to be true about what I was looking for. Yes. And I went down that rabbit hole and started reading. And then I realized it was a paid-for advertisement, and then they wanted you to sign up and buy something, and it was medical. Yes. And I thought it was really interesting how that had happened. We're not going to really have a ton of time left, but I did want to ask you one final question. Sure. We've talked a lot about dentistry. In the field of dentistry, are there other things that people could consider if they wanted a career in dentistry?
Absolutely. So let's say for some reason you don't get into dental school, but you still want to do something in dental care. So we have dental hygienists who are our right hand, basically. They're our co-pilots. I mean, I couldn't function without my hygienist. Right. A vital part in oral health care. We have dental assistants who help us and take x-rays and hand us our equipment, so very vital. We have laboratory technicians who make the crowns or prosthesis for the patients, or there's the front office, which is valuable. You can't practice without a front office, so
it's really a team approach.
It is a team, absolutely.
Well, I can't thank you enough. I mean, I've learned a lot about dentistry, the field of dentistry, how to get in medical or dental school. I know we've talked about the cost of it. I can't thank you enough, and I've heard so many wonderful things about you, so I really appreciate you taking time to be on the show.
Well, thank you, my pleasure.
So once again, we want to thank our guest, Dr. Jeff Kalmowicz, for joining us today. And for more information on our show, you can check us out on the web at GHS-TV.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. We hope you will join us again next month on Let's Talk Business.